So you're 65 and you're eligible for Medicare, but even if you don't need the benefits, you still have to enroll. Why is that? It's a great question. We're going to answer that question. Our Medicare and health insurance experts are here to explain why. Catherine Sevier from AARP, Steve Edmonds from Alliance Insurance Services are taking your questions today. Here's how you get your specific question to our experts. You text it 336-379-5775. All right. So first and foremost, Catherine, let's just break down. When do you enroll for Medicare?
Burn it in your brain. At age 65, you must enroll in Medicare. You can start 3 months before to 3 months after your birth date, but you must enroll even if you are still employed. So show up and enroll. If you are still employed and you have credible insurance, you can waive Part B of Medicare, but you still have to sign up at that point or face a penalty that stays with you for the rest of your life.
All right, so we've got that timeline on the screen. 3 months before, the month of your 65th birthday, or 3 months afterwards. And you just kind of alluded to it just a little bit. You face a penalty. So Steve, kind of let's talk about what kind of penalty are we talking about if we do not sign up at 65?
Yeah, so there can be severe penalties. The penalties come into play with two parts of Medicare. The first part is your Part D prescription drug coverage. So they can penalize you on that if you go more than 63 days without coverage after being eligible for Medicare. And then the other penalty is on your Part B, which is your medical part of your actual Medicare coverage. And that penalty is a lot more severe. It's like 10% per year. And also, if you miss deadlines on signing up for Part B, sometimes you have to wait until enrollment periods come around again before you can sign up. But that's a more severe penalty, up to 10%.
Okay, so we want to make it really clear. When you are 65, you must sign up for Medicare. Otherwise, you will pay some sort of penalty. And I like that we saw that there were two different kinds of penalties that you could have. The Part D prescription. Part B is coverage that a lot of people, Catherine, think to themselves, well, I have a job and I have insurance, so that's why I didn't sign up.
Right. And Part B is the part that you and I think of when you have a doctor's visit, when you go have an x-ray, when you have a physical therapy appointment, those kinds of things. And if you have credible insurance, then your insurance may pay for that now, and you can wait to sign up, or you can waive Part B until you're no longer insured. But if you don't, it won't pay. And you will pay the penalty for the rest of your life, and it's 10%
right,
per
and
year.
We're seeing that graphic up, and it says you can defer Part B. So, Steve, let's talk about if, folks, you're at home, you're coming up on 65 or whatever else, and you know that you're supposed to sign up for Medicare, and your job says, well, you have insurance. You don't need to sign up for Medicare. You say what? We have to do what?
Okay, you still go ahead and sign up for Medicare. You take Part A initially. Part A is your hospital coverage under Medicare, and it's free. The government does not charge you anything for Part A. So number one, it's crazy not to take it. So just, go ahead and sign up for it. It's free anyway. All right, the second part on the Part B, which Catherine was just talking about, that's your medical coverage. What you can do if you're still working and you still have group insurance through your employer, you can do what we call defer. You can defer Part B. And here's why you would want to do that. When you sign up for Part B Medicare, they're going to charge you a premium each month for that. And it's around $164.70, I think, each month. And so if you've got group coverage, you probably don't want to pay that extra $164 when you don't need it, because your group coverage is going to cover you. So you will defer Part B, and later on at age 66, 67, 68, you call Social Security, say, hey, I'm retiring, and they'll go ahead and click in Part B for you at that point in time. And that's perfectly legal and perfectly fine, and anyone can do that.
Okay, gotcha. All right, we've already got questions coming through. This person says, I am on Social Security disability. I'm 62 now. When I turn 65, will my Social Security automatically roll over and will my money increase?
So yeah, so when you get 65, if you're already on Medicare, it'll continue when you get 65. Here's the important point to remember though. If you're 62, you probably have Medicare Advantage as your carrier for your Medicare coverage because it's really inexpensive, and probably 95% of people that's on Medicare due to disability, they go with Medicare Advantage products because most of them are zero premium. Well, guess what? At age 65, you have a new enrollment window there. And you can then come and get a Medicare supplement policy, which in most instances will pay 100% of your medical coverages, and there's no underwriting at that point. So it's a get in free card to get into a really good plan without any medical underwriting. So always remember that when you turn age 65, check with your insurance representative and see if there's something better you can do, because a lot of times you can get a lot better coverage at 65.
Okay, we got a question, Catherine. Someone says, I got a call from Medicare. They wanted me to tell them my number.
Medicare does not do that. So if someone's calling you, it is likely a scam and they are looking for an opportunity to learn more about you than they need to know. So tell them no.
Hang up the phone. Okay, we're going to continue on this conversation about Medicare. We're going to talk about, does Medicare cover you when you travel? And then we've got several other questions here. We want to make sure we get your question answered. 336-379-5775.